Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a very renowned and a very popular orthopedic surgeon, Dr. Vinay Kumar Swami. He is specially trained in the sports injury and he is a marathon runner himself and also a tennis player. And more than that, he has done more than 1,000 knee replacements, the surgeries, and he is an expert in robotic surgery too. But today he is going to talk about the shoulder because the shoulder is so important. We say the shoulder carries all the weight, but no, in reality, we don't carry any weight on the shoulder. So please tell us why the shoulder pain occurs and what it is.
Hello, madam. Thank you very much for inviting me for your program. I'm delighted to share my knowledge about shoulder because this is something which is very common, and people above 50 have a lot of shoulder problems, and they come to us. So, basically, shoulder joint is this. Shoulder joint is a ball which sits inside a cup. It's a ball and socket joint. Shoulder problems can arise from the bones which form the shoulder. There are a lot of muscles, special muscles around the shoulder called the rotator cuff muscles. So they can create trouble. They can have arthritis in the shoulder, which is wear and tear of the joint. They can have ligament problems also. So shoulder problem can happen because of multitude of reasons. Amongst the common reasons that happen that cause shoulder pain is something called as frozen shoulder. Frozen shoulder is very common in people above 40, and frozen shoulder can happen to people who have diabetes, who have hypertension, who have thyroid issues. Even if it is well controlled, it can happen. As you would have experienced, it is quite common after a cardiac event also.
After heart attack also, they can have left shoulder. And since you
Correct.
mentioned about the cardiac, I have to tell you, if somebody is walking upstairs or climbing, and then if they get a pain in the left shoulder, and if it relieves after taking rest within 2 to 3 minutes, it is not the shoulder pain. It is the referred pain from the heart. And that people should remember. And if they have an excruciating pain in the abdomen, and that is also felt in the right shoulder, it could be due to the liver and the gallbladder. So that also people should remember. Every pain in the shoulder is not necessarily due to the shoulder. These are exceptions. Yeah, please go ahead.
Yes. What is something called as frozen shoulder? Frozen shoulder happens to people with a lot of chronic diseases. This is our shoulder joint. Shoulder joint has a covering called the capsule, which covers the shoulder joint. It becomes tight. It becomes inflamed and tight and stiff, because of which patients are not able to move their shoulders. They're not able to comb their hairs. They're not able to scrub themselves. And it is quite an excruciating condition. They can't sleep on the affected shoulder, and their sleep will be disturbed. Frozen shoulder, luckily, is a self-limiting condition. What that means is it will settle down on its own, but with good treatment, it will heal faster. We generally treat patients with frozen shoulder through injections into the shoulder, physiotherapy, certain medications. Very rarely, when all these fail, we do something called as an arthroscopic surgery or a keyhole surgery. We put a camera into the shoulder joint, identify where is the tight structures, and release all that, and patients become all right in 2 weeks. The second most common reason for shoulder pain is called rotator cuff tear. There are four group of muscles in the shoulder. The front has subscapularis, above there is supraspinatus, and behind there is infraspinatus and teres minor. These are special group of muscles in the shoulder. You don't see them anywhere else because there's a lot of rotation involved in our day-to-day activities. So rotator cuff tear can happen in people above 50, even without an injury. These muscles get torn on their own without an injury, which is a normal age-related change.
The spontaneous tear. It's called a spontaneous tear.
Correct. We do a lot of surgeries for people with rotator cuff tear, and more than 90% of the surgeries we do are atraumatic tear. That means the tear has happened without any injury. Rotator cuff tear is another reason. Then the third more common reason is called osteoarthritis. Osteoarthritis is wear and tear of the joint, can happen to a lot of joints. Very commonly happens in the knee joint, but shoulder is not immune to it. It can happen in the shoulder also, but generally happens at a much later age, 70 plus, 75 plus. People have osteoarthritis of the shoulder. These
So
are some
they
of the
have
common
to,
reasons for
yeah.
shoulder pain.
And apart from that, when they have the fracture and that also can injure, no?
Absolutely, absolutely. Bones will be weak in after certain age because of osteoporosis. Even with a minor fall, they can have fractures of the shoulder joint, and for which we might have to do a surgery, put in some metal hardware in the form of plates and screws, and fix that.
Okay, okay, okay. And when do you do the, what to say, the shoulder replacement? The hip replacement we have seen very commonly, and you have done more than 1,000 cases. But what about the shoulder replacement? Is it common or can it be done or what is it?
We do it quite frequently, madam. There are various kinds of replacements of shoulder. It's not just one. There is hemi replacement, there is a total replacement, and there is something called as a reverse shoulder replacement also.
Oh,
All of them
oh,
are indicated for specific conditions.
okay.
The common reasons for shoulder replacement is usually a rotator cuff tear, which has been neglected for a very long time, and they come to us in a stage where we can't repair the muscles and they have arthritis already. So that is one. Then osteoarthritis is another reason for which we do shoulder replacement. Sometimes we do it for very badly broken fracture also. It's called comminuted fracture. When it's broken into
Okay.
multiple pieces and it's absolutely impossible to reconstruct the bone, we replace the
Oh,
bone. So it is
oh,
quite common, though not as common as
okay.
knee replacement, but it is frequently done. Shoulder replacement
Yeah.
also.
How much does it cost, the hip replacement? I mean, the knee replacement, the
Knee
cost
replacement or
wise,
shoulder replacement?
the shoulder replacement.
Shoulder replacement, it depends, madam. Hemi replacement may cost somewhere around 1.5 lakhs.
Okay.
Total shoulder replacement, reverse shoulder replacements are very expensive surgeries. They cost
Okay.
somewhere between 4 to 5 lakhs for each
Okay.
surgery.
Okay. 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 But if it requires, they have to undergo
It
for
has to be
that.
done. Sometimes that is the only surgery that will work in certain conditions.
Okay. Okay. Now, finally, I would like to ask you, what are the do's and the don'ts? Because, people like me, I'm 75, I would like to remain fit and I don't want to have any shoulder pain. So what should I do?
So exercise your shoulder regularly from a very
Yeah.
young age.
Okay.
You got to have good habits from a young age. You can't suddenly say at 60, 65, and now I'll become healthy. It doesn't work that way if you burnt a lot of bridges on your way. So exercise
Okay.
regularly. Exercise should be such that in the whole body is exercised. I get a lot of patients who come and tell me that I walk in the park and now I have shoulder pain because they have not exercised their shoulder at all. Something like yoga is best, which exercises every part of the body, a Surya Namaskara, and a lot of
Yeah.
other yoga postures. Swimming is a great whole body exercise. People can do Zumba, people can do Pilates, people can go to the gym and work out. But
Very nice.
they should do what exercise every part of the body, not just the
Okay.
lower body, which we frequently do, and we neglect our upper body.
Okay.
Maintaining an adequate weight is also important.
Very good.
Overweight person always has more health issues than a person who is of an appropriate weight.
Mhm.
A good balanced diet is important. Sarcopenia is something which we don't speak about very
Yes.
commonly.
We start losing the muscle mass when we grow
Correct.
old.
Correct,
Yes.
correct. Adequate proteins in the diet is very important.
Very
Vegetarians should
important.
take a lot of dairy products. They should take vegetarian sources
And
of
also
protein.
the sprouts and other things. Yeah, okay.
Yes,
I
sprouts,
got it.
broccoli, soya.
Okay. So, yeah. Okay. And what about
So
the dumbbells? Is it advised or not in the little after 50?
it is a very good exercise. It's a very good strength training exercise. People above 50 also should do it, and they should do it in a proper technique. They should not suddenly
Okay.
pick up a 10 kg dumbbell and start doing it. They should
Okay.
start slow, and they should learn it from someone who is actually trained in that and do it.
Hmm.
It is a great
Okay.
exercise, definitely not to be discouraged.
Okay. 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 You told about the do's. What about the don'ts?
If you have a shoulder pain which is lasting more than 2 weeks, it's better to consult your orthopedic surgeon. It could be a frozen shoulder, it could be a rotator cuff tear, it could be something else. So self-medication is something which one should not do, especially in shoulder, because it is required for our day-to-day activities. If you have
Hmm.
pain more than 2 weeks, definitely don't neglect that
Hmm.
and consult your doctor. And there are good treatment for almost all the shoulder conditions now.
Hmm. Okay. So it is so nice, you have explained so beautifully, so nicely how the shoulder is and how it works and what things can go wrong and how to prevent it also. And of course, when nothing can be done, ultimately the surgery is there, which you are an expert. And I think anyone having pain for more than 3 weeks, they should consult the orthopedic surgeon. So thank you very much, Dr. Vinay. Thanks a lot for sparing the time and educating our viewers. Thank you.
Thank you very much, madam. Thank you. Thank you.